Hello, my name is Kelly Lawton and I'm your nursing career coach. And on behalf of the Center for Career Services at GW, we are delighted you could join us for GW Hospital's new grad nursing information session with Stephanie Prococo. I will let her introduce herself momentarily, but I wanted to let you know a little bit more about what to expect from today's session. This session will be recorded, and we do recommend that all attendees use headphones for best sound quality. Stephanie will spend about 20 minutes providing more detail regarding GW Hospital's new grad nursing opportunities and go through specific tips in making your application stand out. All attendees will be intentionally muted and there will be plenty of time for questions at the end. So if you do have specific questions, you can add them to the Q&A box and we'll make sure that Stephanie gets those questions and gets them answered by the end of today's session. So at this point, I am going to turn it over to Stephanie and let her introduce herself and get started.
Hey everyone, my name is Stephanie. I am the nurse recruiter at GW Hospital. I do all of our recruitment for our new grad program as well as our med-surg units for our experienced RNs. But most importantly today, I wanted to just speak with you guys about the new grad residency program, what to expect from it, I'll talk a little bit about like the recruitment process, when we'll be accepting applications and just kind of give everyone a few tips to make their resume stand out. So first off, as far as our residency program, it's essentially a 2-year program where the first year you'll have an orientation period, and then you'll start a year of independent practice, and which will include monthly classes once a month with an evidence-based project. And then the second year will be more about like professional development, and they'll host workshops for being a preceptor, or to become a charge nurse and things like that. But as far as the orientation portion, depending upon which specialty you're hired into, your length of orientation will be different. So for your med-surg units, which we have neurotrauma, we have general medicine, we have general surgery, bariatrics, we have our oncology unit, and then we have our rehab unit. The orientation portion for that is about 10 to 14 weeks. And so then if you want to do critical care, which is our cardiovascular unit, PACU, and then emergency room, or our ICU, that orientation period will be about 16 weeks. And then we have our operating room, which will be about 6 months because there's more specialized training that's involved in becoming an OR nurse. And then lastly, we have our women's services, where we offer new grads into our mother and baby unit and then our NICU unit. And that orientation is about 12 to 13 weeks. And what I mean by orientation, it is essentially a combination of being on the floor with your preceptor and then taking classes. Oftentimes I get a lot of questions about, how many hours am I going to be working? You'll be guaranteed 36 hours. However, you will not exceed 40 hours between the combination of your classes and being on the unit with your preceptor. Once your preceptorship is or not preceptorship, but once you're done with the orientation, working with your preceptor, you'll then begin taking on your own patients at that point. And then, so that's a little bit about what like the nursing program entails. And then as far as like the recruitment process, we will, for our next class, which will be in March of 2021, we will begin accepting applications I believe either on November 1st or November 5th. So definitely look on our website between those times. And as far as like what is needed for the application, is you'll definitely need to submit a unofficial transcript. We require a 3.0 or higher to be accepted into the program. You'll also need 2 letters of recommendation. One needs to either be from a clinical instructor or professor, and then the other can be from like a previous work supervisor, or you can have, both be either from the clinical or the professor. Either one is fine. And we'll also, during the application process, we will send you a nursing assessment, and we will need you to take that within 24 to 48 hours. And then at that point, depending upon your score, we will submit your application to the hiring manager for further review, and then they'll then contact you to schedule the interview. As far as like our job postings, we will open, depending upon each unit, every class, each unit has a specific number of new grads that we can hire. So I don't know for sure, how many we'll be able to accept into ICU this time around. It changes, every class. But we'll post a job for each unit that we're offering new grads for. And you can literally apply to all of them if you want. You can apply to just one. If you're only, if you just want to work in the NICU, you can apply just to that one. It's whatever is up to you. When I do get your application, when I reach out to you, I will ask you like which one is your top choice, or what are your top 3. That way, I can try to narrow down specifically where you really want to work. And then, from that point, if let's just say you wanted to work in the ICU, you had an interview with the ICU manager, they decided for whatever reason they're not going to move forward, I can then at least have a second option so that we can really, work together to get you to the unit, or at least try to get you to where you want to be. So that's a little bit about that. My recommendation is to have all of these 3, there's 4. I know now with COVID, it's been kind of crazy getting NCLEX dates, but if you have your NCLEX date, I will need to take that date down. But as far as like your application, I would definitely try to have all 4 items, together when I ask for it. That way I can move you to the hiring manager. And then as far as like their timeline, I know specifically for the NICU, she likes to review all of the resumes and the cover, not cover letter, but she likes to review all the resumes and the references. all at once, and then she'll make her decision as to who she wants to bring in for an interview. So her process does take a little bit longer. And same with the ICU, just because those two units are typically, more competitive. They tend to gather all resumes at once, and then they'll decide like who they want to bring in. But as far as the other units are concerned, the turnaround time is pretty quick. The sooner that I can get your application to them, and they'll schedule an interview with you probably within the next 24 to 48 hours, and then typically they'll get an answer to me within the next day or two after that, and then I'll present with an offer. So our turnaround time is fairly quick. And I would say typically, I know like with this class, we're coming around Christmas, so there might be some delay, but I know for the last class that I did, I would say I was we were fully staffed by like applications open like the beginning of July, and we were fully staffed probably by like the end of August. So we really try to get everyone hired as quickly as possible. But yeah, I mean, I think that's generally what the nursing residency program is all about, and as far as like the application process. Yeah, and so if there's any questions, I'm happy to answer that now. I see Catherine, one question is, can a preceptor count as a clinical instructor for a letter of recommendation? No, it needs to either be from your professor or a clinical instructor. And also one thing I do, sorry to going back to what I was saying before, but as far as I know a lot of you now like are in your preceptorship. So my recommendation for you is while you're on that unit, to really network with the nurses there, really do your best, really network with the hiring manager, not the hiring manager, but network with the manager on those units, so that they really get to know you. And that'll definitely help make your application stand out. All right, another question is, could you tell us a little more about the nursing assessment? What exactly does that entail? I haven't seen it, like I haven't seen any of the questions, but basically it's just to, find out, like it's more or less like a personality test, just to kind of gauge whether or not how you would communicate with patients or how you would handle certain situations. You get about an hour to do it. So yeah, but I haven't seen any of the questions, but yeah, it's basically just, more or less like a personality test to see how you would handle certain situations. Are we able to shadow units prior to applying to the unit? Typically, yes. However, I know with COVID, certain units are not doing shadowing. My advice is you can reach out to me. I'll give Kelly my contact information. You can reach out to me, and if you have a unit that you're interested in, I can check with the hiring manager to see if they would allow nursing students to shadow. Do you know how the applicant process is for the GW scholars at GW? Yes. So basically, you will apply through PD&E, and then I can send you more information on that, but you apply specifically to the Nursing Scholars Program through PD&E, and then they decide who's accepted into the program. I don't know too much about their application process, but I have a form that I can give out to Kelly that has more information about their program. I do know that as far as like the application, like once you're completed your schooling, as far as like getting onto the unit, we will try to accommodate your unit of choice. However, it's not a guarantee, so I just wanted just to be upfront about that. Any other questions? Okay, hi. You mentioned 4 requirements, which are resume, 2 letters of recommendation, and assessment result. What was the other requirement? We will need your unofficial transcript. So as far as requirements, it's your unofficial transcript. You need to have a 3.0 or higher, 2 letters of recommendation, your assessment results, and then your NCLEX date if you have one, or like when you anticipate to take your NCLEX. So those are the 4 or 5 requirements. And one other thing I wanted to what should you recommend going into your cover letter? Honestly, for me, I don't read cover letters. So, it's just my preference. I would rather get to know the nurse more than reading what's on the cover letter, but yeah, you can put one in, or I don't send that to the hiring manager. I just send your resume. Oh, can you speak to our virtual clinical experiences and how we should list these on the resume? Ooh. I would just, that's a good question. I would basically put like wherever you list your clinical experience, whatever clinical was considered virtual, I would just put in parentheses that was virtual, so that the hiring manager can know, what can kind of just tell which ones weren't really on the unit and which ones were more in a virtual classroom setting. How long is the time commitment for new grads? 2 years on the unit you were hired into. So the program itself is 2 years. We ask that you stay for the full 2 years of the residency. If you're, for whatever reason, you're unhappy about the unit that you're on, you can always, after your year of like independent practice, so after your orientation period, you're able to then transfer to another unit, but you have to wait at least a full year of being on that unit doing independent practice. Can you give a rough estimate on how many new grads are accepted into mother and baby? So this time around, we took a total of 8. And I believe they are most likely going to take 6 this time. It is a very popular unit, so you basically yeah, it's pretty competitive. Oh, can you speak to our virtual clinical experiences and how we should list these on resume? I think this question came in already, but just to reiterate, what I would do is wherever you list your clinical experiences on your resume, I would like put in parentheses, like, if you were on, I'm just hypothetically speaking, like neurotrauma unit, if that clinical was a virtual, I would just put next to it that was a virtual clinical. Yes. Can a virtual clinical instructor be a recommender? Yes, absolutely. And I will say, I do know a lot of students are interested in mother and baby and the NICU. I would really decide whether, because it's very different from one another. I would decide, really truly where you want to be, because I will say, if you apply to mother and baby and NICU, they're going to look at that and they're going to think like, okay, where does she really want to work? Because they're different ways of handling or being a nurse. So just to be transparent about that, really decide where you want to be, mother and baby or the NICU. Does anyone have any more questions or anything like that? Okay. All right. Well, I guess that's it for today. I hope, the information that I provided was enough information. Again, I saw Kelly gave out my email address. Please feel free to reach out to me on there. I'm happy to, jump on a call with you, speak more about a specific unit. I know some educators have, mentioned that they'd be willing to talk to new grads if they have more specific questions about being on a specific floor. So please feel free, and I hope to see everyone's application come November 1st.